First of all, I just want to talk about antibody testing. Do we have, is the world's testing capacity sufficient right now?
Demand for COVID-19 testing is clearly outstripping supply, and the bottleneck is not so much with antibody tests, it's actually with molecular tests which directly identify whether you are infected or not. Demand is enormous, and therefore it is so important that tests are really allocated to those patients with signs and symptoms, patients who are most in need, risk patients. And it's also very important that we do everything, every one of us, to help reduce infection rates by keeping social distance, washing our hands, wearing masks where appropriately. Otherwise, it will be very, very difficult to keep up with demand.
So, Mr. Schwan, do you think in this way we would get a handle on COVID-19? I've heard also the school of thought that actually you have to test the public at large because what's really worrying people is the asymptomatic. Do you think it would be enough just to test people with symptoms? Because, as you said, we need to have a careful use, I guess, of these tests because they're pretty scarce still.
That's exactly the case. As long as we have the scarcity of supply, and as long as the industry as a whole is not yet able to meet demand, I do believe we have to be very thoughtful about allocating the tests in the right way. And it is important that we allocate the tests to those patients who show signs and symptoms of the disease.
Can we sufficiently, test our capacity? Significantly increase the capacity to test in the next 3 to 4 months when there's also winter and fall coming in very much, the North Hemisphere where we could see a second wave?
Actually, Roche has quadrupled its production capacity over the last 4 months. I'm extremely proud of our organization, all the people who are working day and night, 24/7 over holidays, to get out as many molecular tests as possible. The industry as a whole has been ramping up production, but it will still take time until we can meet demand. So for the time being, I would strongly advise to allocate molecular tests to those patients who are most in need, and those are the risk patients, are patients with signs and symptoms.
Is Roche expecting a big second wave of the virus in Europe and Asia and elsewhere in the coming months?
That's very difficult to predict, and it will actually depend on all of us, whether we keep distance, whether we keep washing our hands, whether we keep wearing masks where this is appropriate. That's really the only way to keep this virus under control until we'll see vaccines or antiviral medicines.
So what should policymakers be doing right now to be prepared for that? Is it, just making sure the population, stays as they have been? Is it getting the message across, or is it something more concrete to do with medicine?
It's a lot about reiterating the message so that we stay all vigilant, but it's also important to carefully track the disease, to see how it is evolving, where are the hotspots, and then quickly react and intervene accordingly. Part of that is also testing. Part of that is that we take very specific measures wherever we see infection rates going up. That is absolutely key before we have medicines or vaccines available.
When do you think we'll have vaccines? Will we have a treatment that works efficiently way before we have a vaccine that works?
There's a number of companies working on vaccines. There are some promising first results. We see that people who have been vaccinated develop so-called neutralizing antibodies. So there's hope that these kind of antibodies will actually keep the virus in check. However, having said that, it needs big clinical trials to show the safety and efficacy of such vaccines. So I personally believe that it will still take some time until these kind of vaccines will be broadly available for bigger parts of the population.
Do you think the antibodies, I mean, in people that have had COVID-19, the antibodies fade quite quickly. Is it different for vaccine? And if we don't know yet, when would we know?
There's a lot of research going on. I mean, we only know this virus for a couple of months, and there's evidence that if you have been infected, that you are immune at least for a certain period of time. And there is also some evidence which would suggest that even if your antibodies are decreasing again, that there's a certain memory function of your immune system, so that if you get reinfected a second time after having gone through a first infection already, that you will quickly respond, even if you don't have antibodies in your system anymore at this point. But again, there's a lot of research going on. We still need to better understand this virus, and as we will continue to learn, as the science continues to evolve, we will increasingly be in a position to keep this virus in check.
Mr. Schwan, looking at your report, you saw a 15% plunge in revenue in May. What happened specifically in May?
That was really at the height of the lockdown, when literally healthcare systems closed down except for COVID-19 related cases. So healthcare systems were focusing all their resources on COVID-19, and as a result of it, patients simply couldn't visit their doctor, couldn't go to the hospital. And of course, that meant that there was much less routine diagnostic testing, and there was also, a delay of treatments. The good news is that since June, the systems have found a new equilibrium. They have adapted, and as a consequence, now systems are also able again to treat patients with other severe diseases, and we have seen this recovery reflected in our numbers as well.